Good evening. Halloween is just around the corner. The vampires are brewing their bloody beverages, and the zombies are baking their best brain bread. However, a third horror has begun sharpening its knives for the season. It has many names, but prefers one dirty three-letter word. The top scientists toil year-round developing the silver bullet that will put this monster to rest. If you don't know what I'm talking about yet, it's the flu. Lately, it seems as though there has certainly been a renewal of fear when the words flu shot are uttered. Lines are drawn in the sand and sides are chosen. It can begin to seem pretty hard to know who to trust. So why do our doctors, nurses, and local public health clinics want us to line up like pigs to the slaughter to be tortured with that dreadful, painful prick? We sat down with Abby. She's an expert in the flu shot itself and a childhood vaccine manager at the North Dakota Department of Health to get some quality information on this silver bullet known as the flu shot. Check it out. Hello everybody and welcome to Ty and Sky's Health Pub. We are very excited. We are continuing our series from the health department. We are here with Abby. She is the childhood vaccination manager for the health department, and we are very excited to talk to her today about something that you have all, I'm sure, heard about by this time. We're going to be discussing the flu shot and the influenza vaccine. So I think we're just going to get rolling, and we're just going to hit you with the hard questions first. Sure. What kind of government conspiracy is this?
That is a good question. It is not one, actually.
All right.
Are you sure?
I think so.
Do they pay you to say that? Do you have to? You can blink twice.
Well, I am paid for my job, but no,
if you're
I'm
being
fairly
forced to
certain
say that.
it's not a government conspiracy. No.
Okay. What about
So that's on the table.
Mm-hmm.
Just so we're sure, so it's not like something like like where it's not actually a huge problem, but it's just made out to be a huge problem.
No, influenza is a huge problem.
Okay.
Why? Can influenza kill?
Yeah, influenza is actually a really serious illness, and that's kind of where a lot of people get the idea of, I'm not going to get my flu shot because I've had the flu before, it's not that big of a deal. But flu is weird in that it can strike perfectly healthy people, young, old, anywhere in between, and can actually kill people really, really quickly or lead to lifelong complications. So it's something that's really important to educate everyone from 6 months old to 96 years old on getting their flu shot every year. Mm-hmm.
And maybe I'll just tackle that piece. So obviously, go through life. I've been vaccinated for measles when I was much younger,
Sure.
but it was at one period of time, I think over a few different doses, but at one point in my life.
Yep.
And I have been told that will kind of cover me for a nice long period of time. So why do I need to get the flu shot every year? Is it just much less effective, or what's going on there?
There's a couple different things. So once you get a flu shot, after about 2 weeks, you have your full immune response to that flu shot, but then over time, it kind of goes down. So your response to those specific strains are going to go down. So if you're ever exposed to it, after a year or 2 years, you may not have adequate protection, so you're still going to get sick. The other reason you have to get a flu shot every year is our flu strains change all the time. So unfortunately, it's not there's one influenza vaccine or there's one influenza strain that infects everybody. We have several. So we have a lot of top officials who look at all over the United States and all over the world to see who's getting sick with what strain, what's mutating or moving around and changing, and that's what goes into our flu vaccine every single year.
So mutations.
So
we're
yes.
seeing that. So the flu as an entity is getting stronger then.
Not stronger, not like a Teenage Mutant Ninja Turtle or anything like that.
Okay. I was thinking like
it just
X-Men
changes.
too, you know.
No, like a Transformer, I guess, if you wanted to put in those terms.
Robots in disguise, or So I mean, I guess in this situation though, influenza, first, I guess with the flu.
Yep.
First of all, I've heard the flu used just it's so common of a term. Like people,
It
are like,
is.
oh, I think I have the
Yeah.
flu. I'm gonna have to stay home from work, even though really I just a new game came out, so I'm calling out of work, or like I don't want to go to work today, and
Yeah.
like, not saying you should call out of work for whatever reason, but like the flu is usually a common excuse, and a lot of people just literally be like, all right, I'm gonna go to the ER. They should probably go to other places for it. But, like, depending, they might go to a place and they'll say, hey, I think I have the flu. And then they're like, just write me a note so I can get out of school. So what do you think is this thing of, like, why is it so common? But, like, if it's something that can kill so quickly, why do we treat it like it's not as dangerous as it is?
Sure. So the flu can kind of have some non-general symptoms. And so it can be anything from if you have, headache, you're tired, you don't feel good. A lot of people say, well, I have the flu. Well, you don't really have the flu. You might have a cold or some other kind of virus. A lot of people also associate stomach bugs with flu, which if you work in public health is kind of your nemesis. It drives you nuts. When people talk about having the flu and it's vomiting, diarrhea, things like that, that is not influenza. Flu is a respiratory-only virus. So if you're experiencing those symptoms, you probably have norovirus or something else. So it's generally not gastrointestinal, stomach, diarrhea, things like that. It's respiratory only. And with anyone, there's going to be a huge range of symptoms. A lot of them are going to be fever, you're tired, you're achy. If you've ever had the flu, you have body aches, you have fever, you don't feel good. It's usually respiratory. And that's where you can kind of lead into dangerous things like pneumonia. High fevers are always issues. If you have chronic conditions like lung conditions, I'm trying to think of other ones, but if you have conditions like that, it's going to make them worse. You can lead into organ failure, you can lead into death, all sorts of things from the flu. And some people recover really easily. I mean, some people will be down for a couple of days and be fine later on. You just never know when you're going to that rabbit hole of influenza how you're going to come out of it at the end.
So, is the vaccine important for kind of all age groups, or is the flu more of a problem for certain age groups where they should get vaccinated more often than other age groups?
We used to prioritize groups, and I think that was good, especially in years where we may not have a lot of influenza vaccine right up front at the beginning of the season. We prioritize high-risk groups, and those are going to be very small infants for obvious reasons. They just don't recover very well. Their lungs are not mature. They suffer from other things. And then also the elderly. They have a lot of chronic conditions, and they just don't recover very well. Their immune systems aren't as robust as younger individuals. So a lot of times we also look at healthcare workers because they have to take care of patients who are sick, so they have to be at work, and then you don't want to expose other people who are more prone to have serious consequences from flu. So we kind of prioritize those, but we've moved away from that, which I think is a really good thing. And we just say basically everyone needs to get a flu shot. So flu vaccine is licensed for anyone 6 months and over. There's a bunch of different brands and presentations and ways you can get it. But now we just say anyone and everyone should get it. Because really, it makes sense. If you have someone who's, a 25-year-old young adult may recover okay from the influenza, but then they bring it home to their grandma or they have a young baby at home. And so you're just trying not to expose other people. And then there's also healthy people that die from influenza every year. So I think it's a really good way to just protect everyone, to say everybody needs one.
So would you say that there's this piece, so we heard you talk a little bit about there, is there this piece where there's this social responsibility that's involved with like the flu vaccine, where even though I may not die from it, but apparently can, because fully healthy younger people have, but it's maybe less likely that I would die from it compared to an infant or somebody who is maybe older. Than I am, or has some other sort of disease process, like you mentioned, that affects their respiratory system. It's still important for me to get the shot just so that I don't in turn infect other people. Yeah,
anytime you talk about vaccination, whether it be flu or pertussis or measles, like you mentioned, it's impossible to kind of tease out the selfish act of I want to get vaccinated so that I don't get sick with your social responsibility. That's a huge part of vaccination. I think we're going to talk about herd immunity, is that you have a social responsibility to protect, to not infect others and to protect others by being vaccinated yourself. So that's a large part of it, especially in those adult populations or those healthy adult populations. But it's also important to point out that young, healthy people die every single year of influenza. Even if they don't have complicating or chronic factors, it can happen.
Can you necessarily be a carrier for influenza but not experience any of the symptoms of it? So, for example, could I just be like like holding it onto myself, kind of like I have a natural immunity to influenza or something like in my blood, right? like a lot of plots for different movies and stuff.
You're the cure.
Right.
Yeah.
I have the cure in my blood. You know?
Yeah.
So like if I'm a carrier for influenza, what ways do I actually like spread influenza to people? Is it like do I have to breathe on them? Like what are the ways that people actually get influenza in that situation? If we're talking about like large group populations, if we're worried about everyone getting one.
Yeah, so you wouldn't necessarily be like an asymptomatic carrier or a carrier who doesn't have any symptoms, like if you've ever heard of typhoid Mary or something like that. You don't see that with influenza, but what's difficult about a lot of viral illnesses is you're actually contagious before you feel sick or before you're sick enough to do anything about it. So you might kind of feel run down, you might have a little bit of a cough, but you don't think it's anything that big. So you kind of go about your daily business while you're exposing people and making other people sick before you actually know that you're ill. And you see that with a lot of diseases, actually, and that's what makes them pretty dangerous.
Okay. And you had brought up this term herd immunity. Could we dig in more on that? Can you explain to us what is herd immunity?
Sure. So herd immunity is kind of a concept that we use a lot in public health, and it makes sense, but sometimes it has to be broken down a little bit because we don't want to talk about people as in cattle or herds, but that's the easiest way to do it in this situation.
House, okay?
Right,
like there's plenty. We've all listened to Old MacDonald Had a Farm, you know. So like we know that like you know, and here in North Dakota too, we got a lot of cows too, and they're all like hanging out together. So, you know, I'm just, you know, so what does it mean? Like, if we got like, I mean, would you mind explaining with cows then? Because that would be kind of like, that's interesting. Like, if you want to do it that way. Actually, is influenza then, not to be off topic then, does influenza actually affect like animals too then? Like as opposed to like, can you pass off influenza to a cow and then a cow give influenza to a person?
We have two very different ideas there. So we'll tackle the latter one first. Okay. So whether I can give flu to an animal or an animal can give flu to me. And that's actually how a lot of our novel or new flu strains are produced, come from animals. So you heard of like H1N1 was a swine flu. There's an avian flu, which is bird flu. So what it does is the flu virus will start in an animal, which is not uncommon. And then it mutates like we kind of talked about. And then eventually, if it mutates enough, it can actually go from an animal to a human. Generally, you see that in countries where people cohabitate very closely with animals. So people who have chickens in their huts or live with their chickens, that strain or that virus will mutate so much that that person who lives with those chickens now have that flu virus. When it gets dangerous is when I get the flu virus from my chicken, and then it mutates enough in me where I'm able to give it to you guys. That's when we have a pandemic, which I think you're going to talk about in another podcast. But that's where it gets really dangerous and gets a lot of attention of the whole world, is when it mutates enough. So yes, you can technically get a flu from an animal, but there's a lot that has to happen between then and there.
Okay.
Makes sense. And so I guess for these cows then, I mean like in proximity, so is this a touch thing? Is this like in terms of like passing over conditions, like say if Ty has influenza and he's right here, what type of ways can he give me influenza from just being in proximity to me?
Sure.
Is it more just like does he breathe on me, or like what happens?
It's more what we call respiratory droplets. So sneezing, coughing on your hands. So usually, you know, if people are really sick, they're sneezing, they're coughing constantly, not washing their hands, using doorknobs, things like that. Just really close contact with someone. It's not necessarily going to be just next to someone, but when you're sick with influenza, it's pretty much coming from everywhere. You're sick. So you're coughing, sneezing, things like that.
Okay.
So stay away from me if you get influenza.
And so about this idea of herd immunity.
Yeah. So herd immunity is completely separate from the cows giving you flu. Herd immunity is the idea of a certain percentage that we need to have vaccinated in our population where we can stop the spread of a vaccine-preventable disease. So generally, herd immunity is about you need 90 to 95% of your population vaccinated before you can eliminate the disease completely. And that makes sense if you think about it, if you want to break it down, if you want to think of it in terms of if you have 100 cows and you have, let's say, 20 of them are sick. So that gives you 80 of your cows are healthy, 20% of your cows are sick. So if you kind of have those in one pasture, one field, or one closed-in area, they're going to circulate among your healthy population. And if you don't have high enough vaccination, you're going to continue with that disease. Your healthy cows are going to get sick, or your unvaccinated animals are going to get sick because you don't have a high enough percent of vaccination. Where if you were to bump that up to 90 to 95%, you only have a very small population that's either susceptible, hasn't been vaccinated, or isn't sick. So once you get to kind of those barriers of everyone's either been sick or vaccinated, that disease is gone. And that's kind of what we've done to eliminate a lot of the diseases like smallpox and measles in certain areas, is you get your vaccination rate high enough where if you do have a breakthrough case, it's just kind of squelched right where it lands because it can't go anywhere.
So you're kind of removing any foothold
Right.
that the virus might have.
So you may have a few people, even though they're vaccinated, you may have a few people who still get sick, but because you have such a high percentage of people vaccinated, it's going to be over very quickly.
Okay.
And it's not going to spread and continue to kind of circulate through your population.
And we're seeing kind of like a resurgence of some of these things like come back out in like certain parts of the country.
Yep.
So like I guess in terms of like herd immunity, because it's easier to consider herd immunity like I guess in a pasture in a closed field.
Yeah.
So how does that translate to like metropolitan areas versus like rural communities? Because say if people live out really close proximity in like the same building, like I can understand how that could possibly work. Like Ty and I live in the same building. We like walk by each other. He sneezes on me. I get influenza. But if I'm like living miles away from him, right? Like how does this like necessarily I guess to convince people, like if they're saying, oh, well, I don't live close to people.
I live out in the boondocks.
I live out in the boondocks. I live further away from people. I don't need to get this thing that, like, if they're naturally kind of like hesitant about it, they're like, I don't need to necessarily get this because I don't interact with a lot of people, so my exposure risk is lower than the average person, like, say, living in a metropolitan area. What do you say to them to, like, kind of justify, like, the argument of herd immunity?
Sure. And I'm concerned about your guys' friendship after this. He's really concerned that you're going to give him influenza by sneezing on him.
Hey.
I see this as like a reoccurring topic in this conversation. I'm concerned about that. But anyways.
Yeah, that's what we're learning.
Yeah. So obviously in metropolitan areas, the more closely you are packed together, the higher likely are that you're going to expose someone or be exposed to a disease. So you see a lot of these outbreaks happen, especially in some countries like India and China, where you have very, very compressed populations. You see these diseases break out and kind of move very, very quickly. Where you have a lot of farmers in North Dakota who may or may not see people, every day, but it only takes that one person. So yes, someone who farms, lives by themselves, may not be as high of risk, but they're also rural. So if they get influenza from someone, they're not close to healthcare. They aren't going to have access to that. They aren't going to be able to be seen that same day. So they could potentially have worse outcomes too. So even though they're not necessarily exposed as often, it only takes that one person and they could still have an adverse outcome.
Okay.
So it's kind of like if you think about almost you could equate influenza to the zombie virus.
Yes.
But this is a zombie movie where it could have been prevented from the outbreak point with a vaccination. Interesting. That would be an interesting spin on a zombie movie. We should think about that.
I mean, a lot of them have been have been done already, like 28 Days Later.
But they just keep piling on. It's like zombie movies are recession-proof. Zombie movies are copy-proof. They just keep coming and coming like zombies themselves.
There's never been a zombie vaccine. So there you go. That could be your niche.
Yeah. It's like you take zombies, you change one thing about that plot, and you have a new zombie series.
Every single plot has, like, the vaccine is almost close to being developed, and then, like, something, like, crazy happens, like a scientist like spills the formula, or like they just don't, they mess up the formula, like it's actually making the zombies worse, or something ridiculous like that, which that would actually be a cool movie too.
Not necessarily drive home my point though.
Oh, so, right. True. I mean, entertainment purposes aside,
right.
But yeah, no, I think it's just something that, like, we relate to zombies because like in culture, like it's something that we see, like herd immunity and zombies are almost like they go very much hand in hand.
They do.
And I mean, but I guess maybe in the opposite, rather, if there's more people with zombies, more people become zombies. I don't know, maybe. I mean, it depends how your zombie survival plan is crafted, right? Like,
yes.
True.
And do you happen to have a good zombie survival plan?
I don't.
You don't? Oh,
no.
Okay.
The CDC has one, though. Centers for Disease Control has a zombie plan.
They do have a zombie plan.
So I guess I would default to theirs instead of writing my own.
It's not a bad idea. I know there's a lot of people that like will fantasize about it. It's like, if for some reason influenza turns into a zombie thing, I'm gonna be ready. Like especially
get your canned food and pitchforks ready.
You got to. Yep. See, like before, like
it's about the blunt.
It's about the blunt,
or sharp objects.
Sharp pitchforks work too.
Like those hand-on-hand combat objects. Because guns, you're out of ammo. Your guns are no longer any good.
Yes. True. But of course, though. So getting back, I guess, to this method of the vaccine itself. So in terms of delivery, is there any sort of difference? Like, of course, we're encouraging like everyone, and of course, with this model of herd immunity, we're trying to encourage a lot of people to get the vaccine. Is there any sort of difference in terms of delivery? Because you talked about the difference between the rural and the urban communities in terms of like the vaccine happening. So like if there's not a great access to rural communities to get the vaccine, is there anything being done to kind of address that, or is there any other like programs or other like groups that are assisting in trying to get this vaccine out to your everyday person, to your worker out in the rural community?
Yeah, so we have a lot of really great county health departments in North Dakota that try to reach a lot of those rural areas, because we know that they don't have a lot of clinics or large health systems out in rural areas where the county population is very sparse. And so that's where we come into like rural healthcare clinics or your local public health unit that can try to access their own community and get everyone vaccinated. So there are areas out there. I mean, there are clinics out there and ways to get it. It's just you might have to work a little bit harder or drive a little bit further. I mean, in urban areas, like even in Bismarck or Fargo, you can go to any pharmacy, you can go to any clinic, any county health department. But in those rural areas, you have to work a little bit harder, unfortunately. You have to go out of your way. But I know that they try to make it as easy as possible to get it. It's very widespread. I mean, everyone has flu vaccine during flu season. Including pharmacists, clinics, county health departments. But you may have to go out of your way to get it a little bit.
Hello, everybody. I'm Ty.
And I'm Sky.
There is more information available at our fingertips today than there has ever been in human history. Yet, quality health information remains largely inaccessible, leaving many people confused about key health issues. There seems to be barriers between medical providers and the rest of us, and misinformation about different health topics is everywhere. Knowledge is strength, and we are stronger together than we are apart. As a community, we can work to spread health truth and dispel health falsehoods, ensuring that each of us can make the best decisions for ourselves, our families, and our communities.
Communication is our greatest tool, so we've created the very first traveling health podcast called Ty and Sky's Health Hub.
We would like to start an open dialogue with your communities about the healthcare topics that matter to you, and we would like to use this dialogue to bridge the gap between healthcare providers, policymakers, and the rest of us.
So you're probably wondering how you can get involved with this great cause. The first thing that you can do is create a dialogue in your communities to find out the type of issues that may be plaguing them. The next thing that you can do is tell people about our podcast. That way they can learn about issues ranging from hepatitis all the way to mental health issues.
Together, we can work to help bridge the gap between healthcare providers and the rest of us, make healthcare knowledge accessible, and empower everyone so we can change the face of health across the world.
And kind of one of the things that you always hear when I'm sure we've all heard it, when you are out and about, or even from friends and family members, they say, well, I got the flu shot once a couple of years ago. I still got the flu. So what good did it do me?
Yeah.
I guess I would pose that question to you.
Oh, we hear that all the time. If only I had $1 for every time we got that. Yeah. And I completely understand it. No vaccine is 100% effective, and we know that. The flu vaccine, depending on your person, your immune response, things like that, could be anywhere from 60 to 80% effective probably for each individual person. But there's a lot of things that go into it. It's going to be how your immune system responds to it, if you have chronic conditions that are going to affect it, if the flu vaccine is a good match that year. So we're always playing this guessing game of trying to figure out which 3 or 4 flu strains are circulating in the United States. And then by the time we get the vaccine out, have they mutated or changed a little bit so the vaccine no longer works for it? So that's always something else. And then we're also in the middle of cold and flu season, too. So, you could just have a cold, or you could have something else that mimics the same kind of symptoms. You feel run down, you don't feel good, and people automatically assume they got the flu. So there's a lot of different reasons. But again, it's never 100% effective, but it's better than nothing. It's better than just taking your chances and not protecting yourself.
So essentially, we're going through like a ball pit like of different like similar like because there's similar issues going on that like might be a false positive, for example, and might say, or someone might be like, oh, I have influenza, and it's just like, oh no, it's okay, you're fine. But so we're essentially, so are you saying that like essentially that that healthcare professionals in a way, like in terms of releasing like a vaccine, they're essentially going through like a ball pit, and they're like trying to like figure out like each person, like, all right, so you actually have influenza, and then like, oh, you don't, and then it's like at the same time it's like a guessing game almost, but like, and then you have to rely on people actually like going in,
right?
So
yep, and that's the issue too, is if you go in, a lot of people don't go in, they just say, oh, I had the flu, or they go in and a provider or a physician's office is so bombarded with people with cold and flu and sinus infections and everything that goes on during the fall and winter months. It doesn't necessarily make sense to test every single person. There are lab tests that they can do that'll prove, if you have influenza or not, but at some point they just kind of say, it walks like a duck, it quacks like a duck, it's a duck. They just kind of say, you have flu, go home.
So why is it so seasonal? I mean, why is the vaccine, like we talk about it kind of the same time every year, it seems I start to hear about the flu vaccine, and then like in the summer months I really hear basically nothing. So why is that?
Yeah, it's a cyclical illness, and we generally see between October and April is when our flu season is, but it can continue all the way through summer. There's cases, it's just not as much. A lot of that is just related to our activities that we have. So during the fall and winter months, we're all kind of cooped up. Kids are at school, which is a huge one, at daycare. We're attending college classes. We're working in close proximity with each other. Then when it starts to get nicer out, we get outside, we get some fresh air. We're not as close proximity. So that's why that's why you see a lot of the cases pop up at this specific time.
Okay. And something that I thought was pretty interesting earlier that you mentioned that they kind of play a guessing game to determine what flu strains need to be vaccinated for in a coming year in the United States. How is that guessing game played? Is it a stab in the dark? Does it use what's kind of popular now? I mean, is there some manual for how this is done, or how
do they set up a board game? Like, what happens
like,
for them to actually like do this guessing, or is it just like an educated guess? Is there like a wizard like sitting somewhere in the corner, like I think it'll be these 4 strains? How does it work?
It's a very large dartboard. No, I'm kidding. That was a long pause. Cool. No, so the World Health Organization, or the WHO, kind of looks at what's going on. So the Northern Hemisphere and the Southern Hemisphere have different flu seasons. So they kind of are able to process, okay, the Northern Hemisphere's flu season is coming up, what's going on in the Southern Hemisphere? And look at what strains that we've suffered from in the past, what ones are starting to circulate or show up, and that's kind of how they make their recommendation. So they say, I think, based on this medical knowledge and what the Southern Hemisphere is doing, these are the 4 strains that are going to impact the United States this flu season. And they give it over to the United States, and then the FDA, or the Food and Drug Administration, are the ones who make the ultimate, last call in the United States. And then it's released to the different pharmaceutical companies who make the vaccine. Okay. So there's quite a bit of time lag between when that happens, and so that's when some of the flu strains can kind of mutate or change, and that's when we get a bad match year. So that means, in February of one year, they said, okay, these are the 4, but by October, December, January, when we're getting sick, they've changed a little bit. So that's when the vaccine may not work as well as other years where they had their perfect crystal globe out and were able to magically pick this right 4.
I guess in terms of influenza itself, kind of going into this idea, concept of time, where there's at the start of October, it's suddenly okay, we're in season. But is there anything to do with any sort of temperature, or perhaps any sort of climate adjustments to it that have reasons? I guess, is it a regional issue, or is it kind of because I guess what I'm asking is, does temperature or even humidity have an effect on the spread of influenza?
I'm not sure about humidity. I know with flu vaccines, generally in years past, we've always waited until October, November, December, because we knew, okay, flu vaccine is going to give you the best immune response during this time, so I want to make sure that I have the highest optimal response during the peak of flu season. But they've changed that a little bit, and flu vaccine is now delivered in the summer months. So clinics can start to get their doses in August, September, October, and then we tell them to start as soon as they get vaccine on hand. They're doing a lot of studies looking at how effective is flu vaccine in the winter or in the really warm months when it's being delivered. Because if you know anything about vaccine delivery, is it has to be shipped using refrigerated temperatures. So there's always a cold chain maintained. And so we found, or not me, but they found that in the warmer months, they were exposing vaccine to warmer temperatures and it wasn't working as well. Oh. So now they have to try to figure out how to keep it cold enough during the summer months to get it to a clinic in time to vaccinate you for the flu season and still have that prime response during the peak of flu season. So there's a lot of moving balls involved in getting it to the people who need it at the right time.
And we've spoke a little bit about kind of this piece of a killed virus where certain parts of the virus are taken and put into the vaccine, and then a live virus.
Yep.
Which one of these does the flu virus fall under?
Sure. So we actually have two. We have both. So what happens is we have the 4 strains of the flu virus are kind of grown in chicken eggs. And then, so this is for your flu shot, which is inactivated. And then that virus is then killed and produced into flu vaccines. So all of your flu shots are going to be inactivated or killed virus. Then you have the nasal mist, which is called flu mist, which is the live attenuated. So they take those same strains and they weaken them. So they cannot make you sick, no matter what anyone says. It cannot make you sick, and it's given as a live attenuated or weakened nasal mist.
So if you receive that nasal mist, is there any way, because we've talked about this virus has the capacity to mutate. I mean, is there any way that attenuated virus, as you mentioned, the weakened, meaning weakened virus, will simply mutate in my body and just give me the flu?
No, and something else I should mention is we're actually not using the live flu mist right now. Last flu season, they actually did some studies and found that it wasn't nearly as effective as the flu shot, so we're actually not recommending it last flu season or this coming flu season too.
Okay.
But they obviously look at all of that when they're doing, because it's a vaccine, so it's studied for its safety and efficacy before its licensure and afterwards, and they haven't found that it's been able to mutate or done anything like that, or is not able to make people ill.
Okay.
Well, I think there's so much to it that, like to suggest to people to if these things are constantly changing, it's almost that people have to constantly tune in to see what's up to date on the latest, because it's kind of like you were saying before, like how people have thought, oh, I took it 1 year, why am I not safe now?
Yeah.
And it's because it's like constantly having to be like bombarded with the information. But it's like if it's once a year, it doesn't necessarily have to be bombarded necessarily, but it's like, all right, hey, just a friendly reminder, influenza is a thing, and you need to be careful about it.
Right.
And so, I think though, like the common cold is very, very, it's extremely common. So I think to keep people is it a good idea to keep those so associated, even though they're different, because to not mistake one as the other, but is it good to keep them associated to keep people thinking along the lines of influenza?
Yeah, I could see how. I mean, we try to do education how they're different because you treat them very differently. So if you have influenza, as soon as you figure out or get sick with influenza, we want you to go in and get antivirals, where antivirals isn't going to work on the common cold or something like that. So we do a lot of education to kind of separate those out. But yeah, it's a good reminder. Nobody likes to be sick. I mean, no one, even if you aren't one of those people who has a severe consequence or dies from it, it's still not fun. I mean, you're still home from work. A lot of people don't have leave in this country, so you're taking unpaid leave. Your kids are home from school, things like that. So it's important anytime you're sick to take good care of yourself, and this is one way you can prevent it. I mean, we can't prevent the common cold, we can't prevent those stomach bugs, but we can prevent flu by getting a flu shot every single year.
And a lot of times, I guess in terms of, so we have this idea of a foundation of, why we should be getting the flu shot. But I guess in terms of and we asked more a little bit about access as well, but what about the cost of actually the vaccine itself? Like how much does it cost for the person to go and get this vaccine?
Yeah, so flu vaccine is nice because it's a very cheap vaccine. It's been around for a long time. They haven't changed a lot of the manufacturing processes, so they're able to do it cheaply. So obviously insurance is going to cover it if you have insurance. With the Affordable Health Care Act, and insurance companies cover most vaccines, if not all, at first dollar, so there should be no charge to people. If you don't have health insurance for kids, part of my program is offering that vaccine for free for kids who don't have insurance. If it's an adult who doesn't have insurance, it's usually maybe around $40. It's going to depend on where you get it, how much they're going to charge, but anywhere between $20 and $40 probably. So as far as in the vaccine world, that's a really cheap vaccine.
And this gets maybe to a slightly more philosophical piece on this topic. Do you find it's hard to get people thinking about prevention? Because vaccines are very prevention-based. They are not reactionary. You don't get the flu and then go in and get this done to you that will then help out. Is it hard to get people thinking about that prevention piece? And if so, why?
It is so hard. I mean, not even for the flu shot, but even just for all vaccines in general, because people don't see these diseases anymore. I mean, you don't see measles and rubella on a daily basis. You don't have even physicians who are brand new or who are, 50 and under haven't seen these illnesses, and many of us in our age, we had chickenpox as kids and we were fine. So it's not that big of a deal, but parents don't see how devastating these illnesses can be. And influenza does kill every year. It kills thousands of people every year, but people don't see that. Or they hear about the people who are in the nursing homes or who are 90 and older who are being killed by it. They don't hear about the young kids who, if they don't die, they have severe long consequences from it. So prevention is a really, really tough thing to do because you just don't see it. You hear all these anti-vaccine people or vaccine hesitant people, and you see those celebrities and see those people in the media talking about it, but you don't see the kids next to them with the diseases or the long-term consequences. So it's an incredibly hard thing to do education on. And not that you want those diseases to come back, because that's why we vaccinate, but it would almost make that prevention point easier if they saw it and they knew how severe it was, until it's too late, unfortunately.
And I feel like sometimes we can get to this point where we feel like we reach a certain age and our minds are made up on life based on the situations we've had and the encounters we've had in our life up until that point. You mentioned vaccine hesitant or even anti-vaccine people. Is it your belief that minds can ever be changed once they've been made, or once a decision's been made on a subject like this?
Can we be stubborn forever?
Well, it's difficult because it's emotion-based. So that parent is going in with their teeny tiny perfect little baby, making those decisions based on something that may not be a reputable health source, but it's something that's so emotion-based that you can't necessarily give them scientific or medical-based knowledge, because that's not what they want to hear, is they know as a mom what's best, and that's really hard to argue with. And you don't necessarily want to argue, but at the same time, you have to give them real, actual information about how safe and how efficacious and how effective our vaccines are now, and how we have to vaccinate to keep these diseases out of our population. If we completely moved away from vaccination, they would come back. They're a plane ride away. So you certainly can change people's minds. It just depends on what they need. If they want to hear a parent story of a child who had to go through this, or if they want real factual medical information, or if they trust their healthcare provider enough to trust their recommendations, things like that. But it is possible to change their mind or kind of get them to see why this is so important.
So you see emotional appeal as being kind of a major driving force of maybe those who are vaccine hesitant.
Right.
Do you think emotional appeal could be used to convert them to pro-vaccine stance?
Yeah, and there's a lot of groups that are trying to do that. Unfortunately, they're putting together people who have suffered from these diseases. Like I know for influenza, there's Families Fighting Flu, which is families who travel all over the country who give speeches and appeals to people who have been adversely affected by flu. They've either had kids or loved ones die from flu, and so they're trying to do that emotional-based argument to say this is important, this is real, this could happen to you, because so many people, especially young adults, are so arrogant in that it'll never happen to me, that's not going to be my child, that's not going to be me. Those people were sick, they had other reasons, but it happens to them all the time. So a lot of times it's the only thing that will appeal to them is that emotion-based, realistic point of view is that person was just like you before they died of flu.
To defend those young adults, though,
yes.
I think the young adults...
I'm one of them, so it's okay.
The young
Young-ish.
adults, us young adults coming up, though, I think that there is more of a willingness to listen to the scientific literature of things. I think that there's a lot of, in the older generations, not to say that people are stubborn, but, it's... Well, maybe there are some people that are stubborn. There's people in our generation that are stubborn. Yeah. There's stubborn people in Gen X, Gen Y, whatever, millennials. Yep. And the thing is, though, what's interesting to me is that we this idea of that should we actually tolerate, should we treat a stance that is problematic, that is actually a health risk to everyone, especially in this idea of herd mentality. Like, if we justify people saying, "Oh, well, I don't want to get that," if we suddenly do justify that, isn't that just like that's a harmful thing for our society as a whole, right? Because it suddenly becomes this whole thing where, if we defend that idea as equal grounds or something that is as justifiable to defend as vaccines, it then becomes this issue where, suddenly we're giving that idea like justification to exist. And giving it ground seems like a dangerous thing, especially if we know that if people are not vaccinated in a situation that we can find rampant amounts of influenza happening. So I guess in my opinion, though, it's just kind of something where we just have to be. I mean, it's important to debate a topic, like that.
Sure.
I think it's very, very big to have that discussion. I think though that like just trying like when it comes to the health of, because you always have seen those articles where perhaps someone didn't vaccinate their kid and then like something happened to the kid and then they have like the regret stage of what happened, and then suddenly they're like, oh, I should have done this, and so it's like to prevent situations like that from occurring. Like I don't know, like if always parents always, even if defending like the mother knows best situation, I don't know if that's always true. I don't think people always make the best decisions for their kids regarding their health. Especially since we learn more about social determinants as well, that like it kind of comes down to that. So
that there are different barriers that get in the way to parents making the best decision for their children.
But what's interesting about vaccine hesitant parents is we generally see the largest population who exempt their kids or choose not to vaccinate as are the highly educated middle to higher income white families. So it's all of those families who have access to good scientific medical knowledge, but they're choosing not to vaccinate their families. So it's kind of a different population. And then they also see a lot of celebrities. So I think that's giving standings to points that aren't necessarily backed up with medical or science-based information, but they see it on TV, they read about it in magazines. They assume that it's actual real information, and it's not.
Well, I feel that term scientific research is thrown around so much lately by everybody under the sun. I mean, you even watch local news, and I think there are entire segments every single day on new scientific research that says A or says B. Coffee will give you cancer. Coffee will give you really strong babies. Like it's all over the place. So do you feel, or do you start to feel like the clout that using the term scientific research has maybe been diluted?
Yeah, absolutely. And that's a good point because everyone says everything gives you cancer. So you just kind of tune it out. And you're just being, like you said, bombarded with information left and right and left and right. But it goes back to, I mean, even if you take out the medical or the scientific knowledge, it goes back to history. It's a history lesson. When we didn't have vaccines, we had rampant disease. We have vaccines that are safe and effective, and we don't have those diseases anymore. So it can be as simple as that. It can be, bringing out the New England Journal of Medicine, citing all of these different studies showing that vaccines are safe and effective, or you can choose an easy route too. There's a lot of different ways, and it just depends on the parent and the family which one is going to kind of bring home to them. Do they want to see the emotion-based argument? Do they want to see the actual journal articles and the millions of dollars that have gone into vaccine safety research, or do they want to just open their history book and see what happened?
I want to see politicians' immunization records, and I want to be able to see that they got all those shots, because then people might be more like especially if someone's like opposed to it, I'd be curious to see if they actually got them or not.
Well, and that's a hard part too, is because you have the celebrities who they do anything and they're on the front page of every magazine and newspaper. So they make one decision about their family, and most of them do not want to be on their soapbox for this political issue. They want to be like, this is a decision I made for my family, but they're automatically spread everywhere. But you have millions of people who make this decision every day to vaccinate their child and not only protect their child, but all of their loved ones in their community, but you don't ever hear from them because they did what they thought was right. So I'm sure, I would hope that a lot of celebrities and politicians are adequately vaccinated. They just don't talk about it because it's just, that's what you do. That's the decision they made. It was right. So
I think it's good to just to kind of like settle things out. Then I guess it's something that we just need to work on in the future in terms of just getting this knowledge out. Continue. I mean, even if it's a matter of just talking to people about it, especially if you have family, loved ones, and your friends, to just talk about it even at once, because like even if it's over like a drink or something, or at a fine meal or something, just to talk about it at least one time and say, hey, did you get this? I got my shot this year. It's just another small thing. You have 365 days in a year. Pick one of the days to get it done.
Bring it up.
So this Halloween, as the ghouls and goblins come out to play, make sure that you are prepared to fight off that reaper of your respiratory tract, that slasher of your bronchioles, that stalker of your lungs. It's influenza. By getting your flu shot. Please like us on Facebook to join the dialogue about health issues like this. And a special thank you to all of our pubbers for their generous support on Patreon. Until then, let's raise our glasses for a toast. To knowledge good and true, to the future health of youth, and the prosperity that they bring. For now.
Hello, Ty and Sky from Ty and Sky's Health Hub here. Are you an event organizer looking for a way to take your event to the next level? Well, we also do live podcast events with real health experts about the health topics that matter to your community. If you're interested in having us come out, follow the link and let us know.
Have a good one.